Untold Physio Stories podcast. I'm your host, Dr. E. Recently, I was just lying in bed. Actually, this was just last night, and I moved wrong. I thought I twisted, um, but either way, I had like a moderately sharp pain in my mid back. Felt like, around a rib area. Although you guys, if you've been listening to me for a long time, you know that I don't believe in rib dysfunction, or rib being out of place, I guess I should say. Um, so I ruled this out a couple of ways. Initially, when I rolled in bed, I thought, oh, rolling in bed hurts. So it's got to be a rotational thing, more than likely to be thoracic. I didn't exactly want to wake up in the middle of the night and start doing thoracic whips in bed. I was too tired to get out of bed. I wanted to try to solve this actually in bed. I didn't want to wake up my wife. So rolling in bed hurt, but coughing and deep breath did not hurt. So I tried flexing my cervical spine. That didn't hurt, but cervical extension was blocked almost immediately, probably within 20 degrees or so. I did a little retraction. Retraction reproduced that mid-thoracic pain. So in bed, and if you guys are actually watching the video version of this, you can check that out on YouTube or Spotify. I did my sustained cervical extension. So I put my hands at the base of my occiput, did a light retraction that made it pain-free, and then that light pressure pushing forward only maybe about, a quarter of a pound or so, that made extension entirely pain-free. I was able to hold that for 2 to 3 minutes sustained, and then rolling in bed no longer hurt. Once I got out of bed in the morning, um, well, actually, I should say, doing that sustained extension, it relieved the pain probably about 80%. Once I got out of bed in the morning, my thoracic spine was a little stiff, and I noticed that cervical retraction and side bending to the right because the symptoms were a bit more right-sided, medial to my right scapula. So cervical traction side bending to the right was a little limited. Cervical traction side bending to the left was full. It's still a little limited. So how I'm going about basically self-treating this is not with thoracic whips like initially I thought I would, but more with sustained cervical extensions for 1 to 3 minutes repeatedly throughout the day, plus also cervical retraction and isometric side bending to the right, and then followed with repeated resistance through the range, because normally this would cause peripheralized pain into my scapula, and then a little bit of overpressure. So it was an easy enough thing to rule out the thoracic spine, even though initially felt like thoracic, because it was just in my mid back and it was kind of radiating around my rib or so, medial to my right scapula, and trunk rotation hurt. The thing is, remember that the scapula are the buttocks of the cervical spine. So cervical spine can radiate as far down as to T6 or the inferior angle of the scapula. And if trunk rotation is equal and it's not really limited toward the painful side or away from the painful side, plus coughing, sneezing, something like that, deep breath in doesn't really reproduce it. It's less likely to be thoracic and more likely to be referred from cervical spine. So my go-to would be cervical retraction and side bending toward the painful side, if it's limited toward the painful side, or sustained. The shotgun technique is that sustained cervical extension, and you could also kind of do in that end range cervical extension, you could do isometrics to the painful side, or continuously press backward isometric into isometric extension as you're lightly pushing forward. So I hope this is a quick enough MMT pro tip kind of Untold Physio Stories case, and that this helps you and your patients to be able to rule out rib, or whether it's rib, thoracic, or cervical issues. So if you like this case, make sure to rate Untold Physio Stories 5 stars wherever you listen to podcasts, especially Spotify and Apple, as that helps our discoverability. And as always, you guys have a great day.